Welcome to the Abtrace podcast. Here we talk about all things healthcare, health tech and Abtrace. I'm your host, Dr. Amina Siddiqui. I'm an NHS GP and head of primary care community here at Abtrace. Today I'm really excited to have Shirin Alwash, a Senior Digital Pharmacist here at Abtrace. Welcome, Shirin.
Thanks for having me.
So you've been working at Abtrace for about 6 months. Tell me a little bit about your journey prior to joining Abtrace.
Yes, so this is a very good question. And first of all, I feel so integrated with the team that those 6 months feel like forever now, which is fantastic. I've worked across pretty much all sectors of pharmacy, mostly in managerial and training roles. So one of the roles that set me up really nicely for Abtrace was when I worked for a company that deals with all GP surgeries across the UK in terms of offering clinical reviews and also cough coding optimisation training. So my role there was a regional training manager for the southwest of England, and I had a team of 12 pharmacists who would go around conducting these clinical reviews, and my job was to make sure that we were consistent, following procedures, etc. So I got to see a lot of operational sort of challenges that practices face. And this made me really interested into looking at, okay, what software is out there to help these practices actually get to the root cause of why they're facing these issues in terms of, admin workload, etc. Because really what we want to be able to do is go in and do our clinical roles. And when we're having to add admin on top of that, it takes you away from what you've learned at university and what you're here to do for the day and actually impact patient care. So I had a look, and there is a sort of data intelligence company that lists the top digital health companies across the world. And Abtrace came up. So there was a list of the top 100 upcoming companies in 2024. And this is a year ago now that I was looking into it. There were only 30 of those 100 based in the UK. So I had to narrow it down to those 30 that I wanted to apply to. And I was disappointed to see that very, very few of them actually got to the root cause of the issue. Most of those companies were sort of putting a plaster on the issues. So, for example, offering telehealth services where somebody goes in and helps for the time being, but that's not sustainable. What practices really want is to be able to continue doing their jobs and to be able to provide that care, but with minimal sort of drawbacks in terms of their operations and admin. So when I saw what Abtrace was doing, I was like, okay, great. This is a company actually getting to the root cause of the issue and fixing that, as opposed to this sort of non-sustainable support. So I applied, followed Abtrace on LinkedIn, found this role come up, and now here I am. So I'm really, really pleased that I was able to get this far in the journey and get accepted to the role.
Amazing. So yeah, you joined and the rest is history.
Exactly. The start is now.
So it sounds like you had a really interesting kind of journey and you were looking for something specific. I love what you said. Abtrace kind of fixes the root of the problem. We need to stop putting plasters on top of the problem. And it's absolutely that, getting in. What are the kind of main problems that you kind of saw in that role that you had that you thought we need to fix?
There are a few. So, of course, primary care is struggling. I would say the main problems would be when a clinician is taken away from what they're there to do. So the main problems are things like the admin burden that clinicians have to do, and of course the admin teams. So for example, with clinical reviews, pharmacists typically spend 50% of their workload doing structured medication reviews. This involves quite a bit of admin work because we have to find the right patients, we have to recall those patients in, and then we have to keep, Excel sheets and lists and knowing who to track and who's not come in yet and who we need to message or email again and, persuade them to do that. And then you get to the clinical bit. So that very, very small percentage at the end is the clinical stuff that we're trained for. The rest, A, we're not trained for, B, takes ages, and C, it's boring, frankly. So I found that to be sort of quite a big barrier, especially when you're not keeping track accurately and, patients slip through the net, etc. So in order for that to be consistent, accurate and safe, we need a system we can trust. And this is one of the other reasons I applied to Abtrace, is that it's actually a medically registered device, so you can trust it, and it doesn't take a very long time at all to get to grips with how to use it.
Absolutely. I think we all face that across the board in general practice, this administrative burden, the clinicians, the administrative staff. You mentioned lists, manual processes, it's all done very kind of manually. So, if we can address that, that's a big improvement. So obviously you're a pharmacist by background. Looking at the Abtrace tool, which part of the Abtrace tool is the most interesting to you and to kind of other pharmacy colleagues?
I love optimization view. That is my favorite bit. And I'll tell you why. So the optimization view gives practices a list of suggestions where they can fix prevalence. Practices more often than not focus on QOF points because that's easier to focus on. It's very easy to see where you're at with it. It's less sort of admin time to do that. Whereas prevalence sits on a back burner because it's harder to find those patients. It's harder to see why they've come up. It takes clinician time to dig into these kind of suggestions and issues. So the optimization view presents it beautifully. This is a list. This is the patient. This is the problem, why they've come up. We suggest adding them to this register, accept or decline. That's a clinician's dream. And if I had that back when I was doing my previous role, I would have saved hours and hours, because it would take us days to set up the searches, find these patients, do the clinical digging. And we're talking, doing that across multiple practices, across multiple electronic health record systems as well. So I've worked with EMIS, System 1, Vision, all the rest of them. And I can tell you it's just as hard on all of those systems to do this type of work. So had I had the optimization view back then, it would have saved me hours at each practice. And the reason I love it is because of the impact it creates. So not only am I saving my time looking into this, but also once you've actioned those suggestions, if you hit accept, it will automatically add on that code for that patient. The prevalence is fixed. We're recouping QOF income. And this is QOF income you're going to get year on year for the foreseeable. Whereas if you hit reject, it adds in a rejection code. And actually, I don't have to look at the same list every year. So there were some practices where I would go back a year later and I'm looking through the same list of patients, and it's really demoralizing because I know I did that last year and I know I rejected them last year. So actually the optimization view really narrows down on the clinical work as opposed to the administrative and, digging around kind of aspect of it.
As you said, in primary care, we often, when we're talking about QOF, we often talk about points, and actually it's very rare that we look into prevalence or focus on that or prioritize that. And actually that's a huge loss of income for practices if their prevalence registers are not up to date. And then, as you said, the practices that are thinking about prevalence, it's just such a laborious, manual, time intensive process.
And it's not just the income, it's then the patient has the right code to be recalled in. That's a really important aspect that we tend to forget. So if a patient has got a disease that's not coded, they're not going to get the right messaging and maybe not get the right care. More often than not, you'll find practices are giving the patient the right care because they end up coming in for something anyway. So then we're doing work that we're not getting paid for, which is also frustrating. So it is a safety aspect as well, I would say.
Yeah, absolutely. That clinical safety, your diabetic patients that are not potentially getting called in for, retinopathy screening or foot checks, missing out on those vital monitoring tests every year. And, the practices, as you said, some practices are doing the work, but they're just not getting the income, which is a shame for those practices, missing out on that kind of vital income, which at this time is essential.
Yeah. I've had practices who have actually made their money back on Abtrace within 6 weeks of downloading the tool. Yeah. I've also had multiple practices that have recouped the investment in Abtrace X times 3, X times 4. And that is fantastic to see, because it means that all the other stuff is just free and they've actually made money on top. So, for example, the automating recalls becomes just a free benefit that you've got once you've done this optimization work. And that's just the cherry on top.
Yeah, we've had that feedback from practices that actually just from the optimization view, it's paying for the tool itself. And obviously that's a huge incentive for practices. So great that you've had those experiences with those practices that, you know, within 6 weeks, they've kind of paid for the tool itself, which is amazing.
Yeah. Yeah.
So we talked about, challenges of prevalence registers in primary care. What are some of the other main challenges you think pharmacists face in primary care?
Pharmacists, their roles really vary from region to region because it depends what the priority is there. In terms of let's take a typical PCN pharmacist working, 50% of their workload would be structured medication reviews. The other 50% might either be, repeat prescribing, seeing patients for other purposes. They might be a specialist in respiratory, for example, conducting asthma reviews and things like that. So the challenges that they would face there, I would say, mimic the challenges in terms of the admin team recalling those patients in, because pharmacy teams are responsible for sort of their remit. So recalls for example, prescribing changes would be in their remit. Recalls for the structured medication review patients are also their responsibility. So they also share the same frustrations more often than not as the admin teams, because they're having to find these patients, export that list, upload it to somewhere where they can send a message from it, and then keep track of who's replied, who's not, who do they chase, etc. So to automate these processes would be really, really beneficial for pharmacy teams to keep track of.
So yeah, absolutely. As you said, I think we're all facing the same challenges, the administrative stuff that we talked about, and as you say now, pharmacists that have to run those manual, kind of time-intensive, labour-intensive processes of running a manual search, keeping an Excel document. And we all know that the shift should really be away from all of that to automate the whole thing. And as you say, let pharmacists and clinicians just focus on seeing the patients and doing the patient care. What would you say to colleagues that are hesitant to adopt new technology?
I would say start off small. So I think it's really important that we all embrace this shift, because the future is inevitable. We're all going to have to work with more and more technology. And actually, if you understand what that technology is doing for you in terms of benefits, I think not only does it build your confidence in the technology, but it also gives you the reason to embrace it if you don't have that already. So for pharmacists especially, I mean, we all love a set and forget. We all love to just set something, forget about it. You know it's going to do the job. We have the confidence in it, especially with something that is a medically registered device as the proactive monitoring tool. For pharmacists especially, I would say seek support from peers, because we often work in solo. Most people in GP practices are sort of in their room, door closed, and we're very lucky if we get that lunch break or coffee break where we can speak to other people. So pharmacists are in a lucky position where they're often working as part of a team, and to seek support from, practices nearby that have maybe adopted this technology already as a reference point, first of all. But then also to build confidence in utilizing technology, I think it's important to start off with something that you can easily use. So, for example, our patient view is so user-friendly. And for pharmacists and most clinicians, actually, for them to be able to go on to that page, which is beautifully color-coded, really quick to see, right, where are my reds? Where is the patient overdue? And what is it and why? If that's so beautifully presented as it is, I can't see there being much of a barrier to quickly using that during patient consultations. So starting off with something like that they will clearly see the benefit. And then moving on to helping with that administrative burden. So for example, if you're looking at doing a prescribing review for all patients on Zopiclone, to be able to bring that up and see a list of those patients and then to automate recalling in those patients, for it to be a set and forget type of automation. I don't know why anyone wouldn't love that. And that's where we come in. So myself and a couple of other colleagues, we deal with the training of teams in practices, and we will literally sit with them until they feel happy and confident that what they're asking the tool to do is actually what they want it to. And more often than not, you know exactly who's involved in the bit that you're explaining, because their face lights up when they see, okay, so you've just done this and now I don't have to look at it anymore. No, you don't have to look at it anymore. You've set it. You have reports that come through every time it runs to let you know who's been contacted, who hasn't, who we need to chase if there wasn't a mobile number, for example. And to have the trust in a system and a software doing that on your behalf must be relieving for teams, to say the least, because then they can focus on the stuff that they're there to do, which is to give that bit of advice about Zopiclone or whatever it might be. And that's the bit where we're saving so much time. It allows us to be able to hone in on our interests more. So if that's extra training that they need, etc., they finally found the time for that.
Absolutely. I love that set and forget. Yeah. We all want to do that. We all want to set something up and not have to look at it again.
Yeah.
And exactly as you said, I think having confidence in the tool, having that, patient view that is really easy to use. We've had that feedback a lot, that it's really intuitive, really set out nicely, not too overwhelming, gives you the information. And, training from people like yourselves and your colleagues that are there to kind of give people that support that they need to just get confident using the tool and adopting a new technology, I think is vital in kind of making those changes. How do you see Abtrace shaping the future of pharmacy in primary care?
Okay, so pharmacists, of course, not biased when I say they deserve the best. But I would also add that there's more and more pharmacists working in GP surgeries. So from 2015, when we had £15 million go into recruiting pharmacists in GP surgeries with the 5-year forward view plan from the NHS. And then in 2019, when the additional roles reimbursement scheme came in. So pharmacists working in GP surgeries, I think the numbers are they went up from just 2% back in 2019 to 7% in 2024. That shift where pharmacists are working actually says a lot about the future of the NHS and where we can have that impact. And it says a lot about the training that pharmacists need to have as well. So thousands more pharmacists are doing the independent prescribing course every year. And this allows them to take that sort of diagnostic decision off of the doctor's hands or off of the nurse's hands and be able to support with that side, as well as bringing in their expertise with prescribing as well, and knowing which medications to give, etc. So the way I see Abtrace helping pharmacists is because recruitment has slowed down in primary care when it comes to pharmacists, there's more and more workload on pharmacists working there. And that increase in demand means that something has to give. So the systems that we're working with, EMIS, System 1, Vision, etc., we need to be able to make every single minute count. And we're not going to be able to do that without automation, without softwares that can actually get to the root cause of these issues with administrative burden. So I think for pharmacists to embrace software like the proactive monitoring tool, where they can set and forget, they can find the patients that need to be prioritized, they can quickly look at a patient's patient view in the consultation and just quickly see where is this patient overdue and what do I need to do today. Those quick decisions and be able to access this information quickly will enable them to be not so stressed out with this extra workload that's coming their way, essentially.
Yeah, we all want to not be so stressed out. And if the proactive monitoring tool is able to empower, all these new pharmacists that have come into general practice to elevate the care that they're offering and kind of really offer the best patient care, then absolutely, as you said, it's what they deserve.
I agree.
Thank you so much for joining me today, Shirin. It's been really interesting to hear about your journey to Abtrace and kind of your last 6 months and how you found the tool and the parts that you found really interesting. So yeah, thank you for sharing your insights and thoughts today.
Thank you so much for having me. I really enjoy being here. The podcast, I think, is an awesome platform to share good skills that other people are sort of putting into the tool. It's also a fantastic platform to share good learning, and being able to reach pharmacists working in primary care to show them what we can do to help them is just fantastic. So thank you for that opportunity.